Debunking Gut Health Myths with Dr. Mary Pardee. Hi, this is Jovanka with JovankaCiares.com, and today I have a very special guest, the amazing Dr. Mary Pardee. Hi, Mary.
Hi, how are you?
I'm good. And by the way, I just want to make sure that I'm not butchering your last name.
No, it's Pardee. You got it.
Pardee. There you
Yep.
go. So Mary is as smart as she is beautiful, and I just want from you to hear exactly from her, who is she and what does she do? So go ahead, Mary.
Yeah, absolutely. So I'm a functional medicine and a naturopathic doctor based out of Los Angeles, California, and I'm the founder of Modern Med, which is a virtual telehealth company. So I see patients across the country and really focus on integrative gastroenterology. I specialize in anti-aging as well and hormone balancing and so much more, but really, really dive into gut health from a functional medicine perspective, which means just like holistic, finding the root cause and treating with the most natural means possible.
Absolutely. And that's the reason why I wanted to talk to Mary today. Because she specializes in gut health, and in this particular channel, I talk a lot about issues of the gut, not only from my own experience, but from the experience of my clients. I wanted you guys to hear from a specialist and a doctor, a clinician, somebody that can give you more of a scientific perspective on some of the issues that we all struggle with, especially issues related to constipation and the relationship between your gut and the rest of your body and your ability to remain healthy for many years. Mary, you are obviously now a specialist, but you also were a patient at some point and struggled for many years with gut issues. Can you tell us a little bit about your story?
Yeah, and that's exactly how I got to where I am today, is that really I just became the doctor that I wish I had growing up. So from infancy, basically, I had constipation. And then when I was a young child, bloating, and I got abdominal migraines that kind of presented in that way, but I know it was gut based. And then really just for my entire adult life up until the age of about 25, I had symptoms of IBS, or irritable bowel syndrome, where it was just discomfort and feeling distended, not feeling great. And now I can talk to my patients, and when they say, I've got brain fog, or I'm fatigued, or I'm just like depressed, you really know what that means, because if your gut doesn't feel well, your whole body doesn't feel well. And so having like a full formed bowel movement every day is so much more important than just going to the bathroom. It can really change how you feel from a systemic perspective of just, making sure that literally things are moving. Right. So I have like a lot of empathy and sympathy, and I know where people have been. I had SIBO recurrent and, some yeast overgrowth issues as well. So I've kind of walked the walk, and I can honestly say that I have no gut symptoms at all, as long as I take my magnesium at night, and I do my stress reduction and all my meditation and things like that. But I feel so good. So I'm just hoping to be that person for somebody else that I didn't have when I was growing up, because I went to every doctor and got no answers and was frustrated. And
yeah, no, I bet. I mean, that's the same. Literally, you're describing the story of my childhood, of like pains that were debilitating, and nobody knew what was wrong, but nobody also told me to change my diet. And what I also loved about what you're saying is, I hear you use words like stress reduction and meditation, and it sounds like in your practice you're not only addressing foods and supplementation, but also all other mind-body things that happen, with the understanding that we're not just a stomach and a brain and a lung and maybe some kidneys. We are just the sum of all its parts, right?
Absolutely. Yeah. Our whole body communicates with other organ parts, right? And for me, the brain is the top of the system. So your brain tells all of your other organ systems what to do when. Yeah. And so if you're not in a state of like high parasympathetic tone, which is rest and digest, then your stomach is not going to work. So So for me, the mindset piece of it and the meditation and the stress reduction piece was a huge piece of it. But other people come in and they've got that in place, but they're really, you know, their diet, or they've got underlying like overgrowth of bacteria or something that's contributing, and that's not in place. But you can't just have one of them. You need to have all of them in place.
Yeah, absolutely. So I wanted you to help us debunk what I like to call myths. I'm not sure that they're myths necessarily. They're just things that I hear from people all day long. People telling me I don't, you know, like, well, you know, I get constipated every so often, or I don't feel like my bowel movements are completely as full as they could be, or doesn't everybody get gassy and bloated? To me, that is just a big heartbreak, because no, you're not supposed to. I keep telling people, no, you're not supposed to feel this way. This is not the norm.
Mm-hmm.
So is it that this is obviously my experiential opinion. Other people seem to believe that is what happens to everybody. So why don't you go ahead and debunk that myth?
Yeah, absolutely. And yeah, you don't want to feel like you're not in your optimal state all the time. So what's normal and what's optimal are totally different. So what's normal and average in America right now is to have multiple chronic diseases, to be overweight, to have cravings. You know, that's not what we're striving for, especially in functional medicine. We're really looking to feel your best all the time so that you can go and achieve your highest vision of yourself, whatever that may be. So when we talk about normal digestion, you have to understand the digestive process altogether, right? So we go through that in the course, but basically you want to be having at least 1 to 3 bowel movements per day. You want to feel like you've fully evacuated. You don't want to have stomach discomfort or bloating all of the time. And you want your bowel movements to be solid and well formed, but not hard little pellets, but also not loose stools. So you kind of want to be in this middle range for everything. And the other side of the spectrum is that some people will come to see me and, you know, they pass gas like twice a day, or they have reflux if they have fried food and dairy and gluten and all of these things. And that's actually normal. You're experiencing normal things because you consume things that aren't, you know, healthy for you. So I don't even say if you eat like a bunch of ice cream, or if you had fried food and you have symptoms, that's okay. That's just your body telling you, hey, that wasn't food. Give me real food next time and I won't do this, right? So it's finding this spot where you feel good on a daily basis, as long as you're giving your body what it really needs and what it thrives on.
Wonderful. That's such a great, important point for everybody. And I love what you said about the difference between normal and optimal, which is actually critical. Another thing I wanted to talk to you about is I guess, again, I don't think we should call it myth, but this issue of hormones, especially with ladies, even though it actually happens with men as well, but women seem to be affected by it more. At least they comment or express it more often than men do. Hormones and the relationship between them and your gut, right? You probably see people that will tell you, right around my period, I feel a certain way, or, you know, when certain things are happening and I feel a certain way, then that seems to be affecting my gut. What is the truth behind all of that?
Yeah, and everything affects your gut in some way. Almost everything affects your gut in some way. But yes, women's hormones specifically, women will notice a big shift between their luteal phase and their follicular phase when it comes to their bowel movements. So in a woman's cycle, you have your follicular phase, which is mainly when estrogen is a little bit higher and progesterone is lower. And this is going to be from your period up until ovulation, right? So it's estrogen predominant. And then you have your luteal phase, which is going to be progesterone predominant. So progesterone rises after ovulation in case you were getting pregnant to sustain a pregnancy. And then you get a little bump in estrogen, but progesterone is really the second half of your cycle, from ovulation to then your next period or your first day of bleeding. And so this luteal phase is when we see a lot of shifts happen. And it's because progesterone is so high during these phases. Progesterone is an amazing hormone, and we want it to be nice and high because, like I said, it helps maintain a pregnancy and kind of secures the endometrial lining of the uterus for implantation. However, However, progesterone can also slow down motility in the GI tract. And this is why you have symptoms of reflux when you're pregnant, when progesterone's nice and high. So a lot of women will experience reflux, because reflux is really partly a motility disorder where things are going up instead of down, right? So
Right.
motility is always involved in reflux. And then the other thing is you get constipation right before your period, because progesterone is going to slow the entire GI tract down, which is no fun. It's also why women will experience a relief of symptoms as soon as they start bleeding, when progesterone has like fully dropped and that's not inhibiting the GI system anymore. So yes, your hormones have to do a lot with your GI tract, and estrogen does as well. So it's not like estrogen is this miracle hormone for motility. Instead, what we usually see is estrogen-related hormonal conditions, especially endometriosis, can really mimic IBS. And people with endometriosis have a higher incidence of IBS than women without endometriosis. And so even though it's an estrogen-related hormonal condition, the inflammation can sometimes be in the intestinal, system. So we get actual endometriosis when you have endometrial tissue that forms outside of the uterus and can be painful, a lot of discomfort, also bloating that they can experience, but it really sometimes will present just as intestinal discomfort, really similar to IBS. So you have to figure out and work with a doctor who can differentiate, is this endometriosis that's the real issue, or do you have IBS, or is it a combination of the two, and really targeting it from both a gastrointestinal perspective and also an estrogen imbalance perspective. So we'll do a lot of hormone testing for those women as well.
Yeah, that's actually really interesting. I didn't realize. In fact, my endometriosis was actually discovered because of the symptoms of IBS, which I had like 15 years ago. But nobody until today explained to me how they were actually, they interacted with one another. So thank you so much for that. My guess is that the topic of hormones is really vast. And it's not just these two hormones that you mentioned. There's many others that also affect our gut health. And unfortunately, we don't have time for all of them. But I also wanted to ask one last question, which was, it's about over-the-counter remedies. Like a lot of people, these are some of the most popular and best-selling products in the market today, certainly in North America. A ton of people go to the pharmacy looking for any issues, anything that will help them with their issues, whether it is reflux, GERD, gas, bloating, indigestion, constipation, diarrhea, loose stools. I mean, you name it. What is your take from a doctor's perspective about these particular remedies?
Yeah, and it depends on which remedies we're talking about here. So, we have things like Tums that can be definitely used intermittently for reflux. It's not my go-to, and a lot of these are just going to be putting a Band-Aid on the symptoms. So if you have anything that's recurrent, you haven't addressed the underlying issue. If you have reflux twice a year when you splurge and have something, of course, that's when we can use something like an H2 blocker, like Pepcid or Tums or something, if it's so, infrequent. But when you start relying on these things on a day-to-day basis, then you're really just covering something up that you haven't addressed. So that's where it's kind of a catch-22. And there's a lot of great over-the-counter things that you can use. Like you can get ginger over the counter. You can get you can get all these natural things over the counter too. You don't have to be going to, CVS or taking the medications that are over the counter. But it's really, drug specific on which ones I use and which ones I don't. But the overarching idea is that if you're reliant on something every single day, then there's likely something that's boiling underneath that's really kind of triggering the cause, or you haven't changed your diet to a whole foods diet, or you haven't incorporated enough walking into your routine. Like walking is my favorite thing for gut health. It triggers the parasympathetic, the vagus nerve. It gets your body moving, but it's also really gentle on the body and can even put you into a meditative state. So making sure that those foundations of health are in place and you're not just going to, the over-the-counters on a daily basis to hide anything.
Yeah, it's really incredible when you think about how most of us that are working as advocates continue to repeat very different, similar versions of the same thing. Go back to simplicity. You know, you would think that if somebody tells you just take a long walk, the patient might be like, that's what you're going to recommend me? Really? That's it? And it's like, well, it's incredibly powerful. So you can actually listen to me or struggle a little longer. So for those of you who might be wondering, what can you do to figure things out for yourself, right? Whether it is going to a doctor, might be that you cannot find a naturopathic doctor or a functional medicine doctor in your area. What can you do to help you learn a little bit more about yourself before and incorporate certain practices before you can actually take it to the next step, which will be going to a functional medicine practitioner? Mary has an amazing program called Gut Health with Dr. Mary Pardee. I keep saying Mary and then Marie. I'm really confused. This is what happens when your first language is not English.
I like it. It's got a little twist to it.
Yeah. So she has an amazing program. It's only 10 days, but it's packed with information. And if you know a little bit about me, you know how much I love lessons that are really concise and to the point, but are packed with information that could actually change your life. So I wanted Mary to tell us a little bit more about her program, again, called Gut Health with Mary Pardee, Dr. Mary Pardee.
Yeah, thank you. It's so it's a 10-day program. It took me 9 months to write. So it was like birthing a baby or, you know, incubating it, quite literally and figuratively. But so it took a long time to write because I really wanted to dump my whole like integrative gastro brain into it, all the things that I've learned. But the idea with this course is that I can't see everybody on a one-on-one basis. And a lot of people can't see me or won't be able to work with me or other functional medicine or naturopathic doctors. And so it's an entry point that allows people to get the knowledge to be able then to talk to their doctors and ask the right questions and, you know, ask about the testing options. So we go through everything from testing options that are either conventional as well as functional medicine tests that you can also use to help figure out what's going on with your gut. We talk about alternative treatments, herbs, we talk about nutrition, the elimination diet that's specific for gut health. So it's not your typical elimination diet out there, but really gastro focused, because there's things that can really bother your stomach, but don't typically bother other conditions when we talk about it in functional medicine. So we talk about nutrition, we talk about exercise, we talk about the gut-brain connection. We really deep dive into the gut microbiome and the research there. It takes about 17 years for clinical research to reach the doctor's office practice, right? And so it's my goal with this course to really limit that time and give you the research that's available right now so you can talk to your doctor about it and start implementing it, because we know that some of this works and is related to our overall health. So yeah, that's basically the course, but we cover every condition from IBS to SIBO to inflammatory bowel disease like Crohn's and colitis. We talk about cutting edge therapies that aren't even approved in the United States yet, like helminthic therapy and fecal microbiota transplantation. So it's really more of an educational course than anything to help to empower people to start to take control of their gut health to really optimize their entire body.
Yeah, I love it. That's exactly right. It's also a course that will get people excited and curious to learn about the parts of their bodies that they cannot see, right? Like we may know our skin very well. I mean, especially us ladies, we study ourselves to death, but we don't know the parts that we cannot see. And while we can tell when our nails, for example, are not necessarily healthy and we need to, or our hair or our skin, we need to learn a little bit about those conversations that our internal bodies, especially our gut, are having with us, so that we can understand when something is out of balance and then address it. I love the course, Mary. It's just, like I said, it's to the point, but it's also packed with information, and it's done in a way that even if you're not a practitioner, you're just simply somebody that is very interested in health and nutrition, or just simply interested in becoming a healthier version of yourself, you can actually follow it and incorporate it and implement it almost immediately.
Yeah, absolutely.
Yeah. So for those of you who are interested, I'm going to put the links in the description below so that you can check out the course. It's also very inexpensive. I think it's like $199 or something like that.
Yep.
So,
For 10 full days.
Yeah. And then we're talking about what, $20 a day?
I know. Yeah. If you think about it that way,
it's literally a lunch for most of us, and it's information that you can carry with you the rest of your life. So it's truly a really incredible course. I'm really excited. I just signed up for it, and I'm just going to start listening to it because, every day you learn something new, and I'm a student for life. So Dr. Mary Pardee, I thank you so much for taking the time to answer our questions, debunk some myths, and hopefully we will see you on the other side of the course.
Absolutely. Thank you so much for having me. It's an honor.
Absolutely. And so for you, please make sure that you comment with your questions or any questions that you might have for the doctor. I'll be sure to pass the information along. Make sure that you share this video with all of your friends all over the internet, and that you subscribe for more tips and a jolt of motivation for your healthy, happy, and beautiful life. See you soon.